Once someone is diagnosed with hypertension, it's important for that person to receive appropriate treatment. Importantly, the treatment of hypertension lowers a person's risk of death, heart attack, and stroke. There are two types of treatment for hypertension: lifestyle modification and medication. When a patient follows the treatment closely, hypertension can be controlled to a systolic blood pressure less than 140 and diastolic blood pressure less than 90 millimeters of mercury. Lifestyle modification includes eating a healthy diet, reducing salt intake, and increasing physical activity. Achieving a healthy weight is also important for people who are overweight or obese. Not using tobacco products and avoiding heavy alcohol drinking will also benefit health overall. Lifestyle modification is recommended for all patients with hypertension, including those who are taking blood pressure lowering medications. Lifestyle modification can be very effective in lowering blood pressure, and is often as effective as a single blood pressure lowering medication. How someone maintains a healthy lifestyle can vary by country and region because types of food and opportunities for physical activity vary. Okay, so let's look at some examples of lifestyle modification in more detail. Regarding a healthy diet, eating 5 or more servings of fruit and vegetables is recommended. One serving of fruit could be an apple, banana, or orange, or a half cup of cut fruit such as sliced mango. One serving of vegetables is typically a half cup of cooked vegetables like carrots or broccoli, or 1 cup of raw greens. A healthy diet is also limited in sugar and sugar-sweetened beverages. For salt intake, the healthy goal is to limit salt to 5 grams or about a teaspoon per day. If a person can't reduce salt intake to this level, even a smaller reduction of salt intake will still help lower blood pressure. In some countries, most of the salt is added during cooking and at the table, so using herbs, citrus, and spices instead of salt and salty seasoning can help reduce salt intake without changing the taste of a meal too noticeably. By cutting back gradually on salt, changes in taste are quite minimal. In fact, after a few months of cutting back, people often find that they prefer foods with less salt. In other countries, people get most of their salt from processed foods and from eating out. Restaurant and street foods can be very salty, so it's important to choose carefully. Processed or packaged foods are often high in salt, so it's better to try options with low salt or low sodium labels if available. For some people, their job may provide most of their physical activity. For others, they may depend on exercise outside of work. Unless there are any medical restrictions against exercise, the goal is to be active enough to breathe a little harder and make heartbeat a little faster. For example, a brisk walk 30 minutes a day, 5 days a week is a good way to exercise. Medication types that can effectively reduce blood pressure and have a low risk of side effects include calcium channel blockers, angiotensin receptor blockers, ACE inhibitors, and thiazide diuretics. In many countries, these are available at low cost. The good news is that most individuals can be treated with any of these medications. The number of hypertension medications needed to control blood pressure can substantially vary across patients. Some patients can be treated with a single pill. Others may need 2 or more medications because they may have very high blood pressure. Whether a person needs 1 or multiple medications, the goal is the same: controlling systolic blood pressure to a level below 140 millimeters of mercury and diastolic blood pressure below 90. The treatment of hypertension is lifelong. Most patients need to be counseled regularly regarding lifestyle modification and have their blood pressure monitored routinely. They will be treated with hypertension medications for their entire lives. Alright, let's summarize the key points. First, treatment of hypertension can reduce the risk of death and disease related to hypertension. Second, lifestyle modification and blood pressure lowering medications are 2 types of hypertension treatment that can control hypertension. Third, maintaining a healthy diet with lots of fruit and vegetables and a low salt intake and increasing physical activity are key for lifestyle modification. Fourth, there are several types of effective and affordable medications with a low risk of side effects. Fifth, treatment of hypertension is lifelong.